Minister, I spoke to you here last week or 2 weeks ago about this whole situation regarding the private hospitals. It's shocking. I know the reason we took them over, and now it's time to put them back. I have private cover is not a privilege in Ireland. It is a necessity, as many middle-income families are not entitled to a medical card. So, Minister, it was right at the time, but it is wrong now to continue it, and it's shocking. I have figures here that I got from a woman from Cork who contacted me about her sister, and it's so sad. For the last 45 years, my sister has paid into the private health insurance to cover all hospital stays. She has never asked the general taxpayer to pay for her medical treatment. She is now 66 years of age and in need of urgent surgery for a stage 3 prolapse, which could go to stage 4 in emergency at any minute. Her consultant tells her it will be July or maybe September. Each day that this surgery is delayed means further damage is happening to her body inside, Minister. This is shocking. And there are thousands of cases like this, thousands around the country. It's particularly upsetting at the moment when private hospitals have the capacity to deal with the situation at no expense to the state. I mean, after 45 years paying insurance, and to be blackguarded this way. Minister, she also gave me figures about inpatient beds at hospitals in Cork, and the bed occupancy, and the bon secours, and she has it done for the weeks of April 14th, 20th, 28th and May 7th. And I hope you're listening to this, Minister. I know what's going on. The bon secours had in April 14, 30, 16 next week, and 85 and 103 out of 300 beds. Shocking waste of facility. The Mater Private in Cork, and this is probably worse in Dublin, 102 bed capacity, 6 1 week, 25 another week, 37, 23. Shocking, Minister. There are women out there waiting for cervical smear checks. There's all kinds of checks to be done. Private consultants to do it, and they're not getting it done. And you're fighting and running over. What is going on, Minister? Is this a scam or a pandemic? Because I think it's a scam, and this is a scam. And people have been bled dry to pay maybe 100 quid a week to have life cover and can't get it, or have a health cover and can't get it. I have another poor man in my own constituency contacted me last night, a decent man, a grandfather, a father, a husband. He spent 17 years in the Irish Defence Forces, and he attended, Mr O'Brien attended A&E in Clonmel last night at 11 p.m. and was discharged again at 2:30 a.m, having been told there was no urologist available at the moment. He's in excruciating pain, and his family brought him to WH, which I support the previous speaker about the cath lab for the South East. And they were told today he's been informed that there's no urologist on duty in Waterford Regional Hospital, either due to the current situation, what is going on in the hospital, wait for it, are suggesting transferring him to a care home. A care home, without even being tested for COVID or anything else. What are you doing? I mean, is it because he's 73 he's no longer fit for a hospital or to be treated? And he's just put into a home and get, like he did to the nursing home, put people with the COVID into the nursing homes and infected all was inside them. That's what you did. And I hope, like Spain today, challenges the Supreme Court, where ministers and senior officials, mind, are being held to account. And that will have to happen here too, because the willful waste makes woeful want. And this blackguarding that's gone here, Minister. I want to also ask you, Minister, about St Bridget's in Carrick-on-Shore. A community district hospital, wonderful place. I outlined its benefits before. But there are 3 hospice beds there, as well as other beds for convalescing. They're taken over, commandeered for COVID, and nobody inside and the lights out in it. When is that going to be reopened? When are those families who fundraise for those hospice beds going to be allowed to see their loved ones in their last moments under hospice care, when they have the palliative team to do it and an excellent staff and management at that facility? Our ladies in Cashel, big fanfare again. You saw it a couple of years ago with me and other TDs. Your jaw dropped when you saw the condition wasn't empty. Hey presto, the COVID brought one good wish. We thought it was going to open up the beds in Cashel. They're still not in there, in spite of doing all groundworks outside and laying new flowers and curbs. What the hell's that got to do with anybody inside in the hospital? And now they can't get curtains. And I heard you on the 6-1 News, Minister, saying you couldn't go in and buy a curtain in the curtain shop because of the home maker shops and home care shops. Sure to God, the HSE can procure curtains. Or can you get blinds? Or can you get mattresses and put up in the windows? Or cover them somewhere. This is a scam-demic, Minister. And the 200 quid per test. I can outline people who have been tested twice going to hospital. I can outline people who haven't been tested at all, as been related a minute ago, like Danny Healy-Rae. It's just to look at a draw where capacity is, and people are making a lot of money out of this. 200 quid a test is outrageous. It's extortion. It shouldn't be allowed. I had a woman visiting COH, and she was instructed that she should go and get a test, which she did. And then she was told 3 days later the test was out of date, she should go again. 400 quid down the drain. Not to her, thanks, but the taxpayer. Where is this going to start, Minister? And when are we going to get the private hospitals back and the consultants? We've listened to Professor O'Keefe and many others, and the doctor here in Dublin who resigned because of the blackguarding, the lack of oxygen that you have for patients in nursing homes. How can you sleep at night thinking of this? How can Dr. Holohan and these people that are spouting out these laws, and as far as the 1 metre distance, CUH, a very close relative of mine attended last week, was asked to social distance 1 metre in the hospital. 1 metre.